knew you had
now.
I knew you had a son, but I didn't know it was a newborn.
Well, he's not a newborn.
Oh, well,
he
we said
just turned
newest
3
mom.
years old, but
I was
that's
gonna
still
say-
relatively. We can
All right,
count on
then.
over. There he is. Give him a wave. He's got his face on. As you can tell, he's a little bit grumpy. We are here at the March for Babies, you guys. Jared, Jamie, good morning to you. Such important work being done out here by the March of Dimes. This table, we're handing out a lot of important information about how to make sure that your children stay safe while they're sleeping. A disturbing statistic is that 65 babies died because of some sleep-related incident in the last year, and that is just too many lives lost, and that is so avoidable. I want to bring in Rachel Perez, who is a nurse. Thank you so much for joining us this morning. You've got your family behind you, and this has got to be an important issue that, as somebody from the medical community and as a mom as well, it's got to just frustrate you so much because the message is very simple. What do we need to know?
Well, we need to know that, first of all, we want to make the environments very safe for our babies. And so it's very important that we're always placing our babies to lie on their backs.
Okay.
And that's at nap time, at nighttime. There's other things that we can do to protect our babies because they can easily get strangulated, they can get entrapped, or suffocate. And so these issues are very important as a nurse and as a mom, as you mentioned. And so we have our baby here, and just like you see the baby lying on, his back, that's what you want. And you see there's a lot of things in this little pack and play that we don't want the baby to be around.
Okay, so let's go through what is right and what is wrong about this situation. We've got the baby swaddled, which is absolutely the way to go, right?
That's correct. And so we want to go ahead and place the baby on their back, but we have this blanket that's here. We have some toys that are in the pack and play, and you don't want anything else around the baby. The other important thing is that, if people in the family are smoking, you want to keep smoke away from babies because that also increases the risk for SIDS, which is sudden infant death syndrome. You also want to have maybe white noise. You can also do white noise for babies. And then you want to just make sure that it is mattress as well, and if there's a fitted crib sheet with that mattress.
Right, and you don't want to have any pillows, you don't need anything else. And we were taking a look at this, has a very thin sort of a trim around it, I guess, but we want to stay away from those thick baby bumpers.
We do, and so that's one of the things, parents love to purchase that whole crib set with that baby bumper.
It looks so cute, and they're still showing it in stores, which is frustrating to me.
That's correct, and so the baby is going to be safer if you just remove that. So the crib should be completely empty.
So it might look sparse, but it's really safety first, and it's always great if you can afford to have a baby monitor, either video or at least audio, so that you can make sure you can hear your child and hear that little breathing, because especially as a new mom, you're always worried and you're listening so closely.
Right, that's correct. And you can also have your baby sleep in the same room with you in their own space, in the crib or pack and play.
But co-sleeping, we discourage.
That is correct. And because we're parents, we get really tired, and so we could easily sleep, get on top of the baby, and we don't want to, do those things.
And you understand the reason why it's a loving thing, but it's better to be separate. Rachel, thank you so much. We want to thank the March of Dimes out here. We're going to be talking about a lot of the great programs that they have, not only to protect babies who are born prematurely and to help them become healthy, but also to inform all of us parents out there how to take